Hi there. I wanted to take a few minutes over the next 4 days to talk about something really important, and that is how to find the best therapist for you. It seems like that would be an easy proposition given today's abundance of information via the internet, but it's more difficult than people think it is. And when it gets to the point where we need a therapist, oftentimes we feel pretty lost and confused. So I'm going to offer some ideas to you to hopefully make that process a whole lot easier. One of the things that I am working on is building and developing this website called Psyche Finder. And that is created with the express purpose of addressing these needs. So I'm going to be talking about that a little bit as well. The very first thing, so I'm going to talk about 4 steps, one each day for the next 4 days. The first thing you need to do is pretty obvious. You need to find a few options for therapists that take your insurance and that are reasonably close to you. So that's not so hard to do. There's plenty of registries of therapists and counselors and clinicians like Psychology Today where you can filter for that information and get some basic choices going. But after you do that step, it's a little harder to figure out what you're looking at. So these days, the world of mental health care has become increasingly complex with tons of people with tons of different credentials, essentially doing similar jobs. So you might run across a social worker who is working like a traditional therapist, or you might come across a psychologist who's doing a very similar job, but was educated very differently and probably has a very different perspective on the job. And the list is really pretty endless. The types of credentials these days are vast, I would say. I mean, it's really a long list. So after you pick from wherever you are working, now if you go to Psyche Finder, we do this piece for you, and that's one of the important parts of the service that I'm trying to create. But if you don't use Psyche Finder, you find your 3 top picks for insurance and location. And, just you look at their picture probably and try to get a sense of like, who is this person and does that look like someone I might relate to, and read their bio and all that sort of stuff. After that, I would recommend Googling the letters after that person's name. So if it's a social worker, it's going to be certain letters. If it's a licensed clinical counselor, it's going to be certain letters. So whatever the letters are, I would just punch them into the search engine and see what pops up. And that's going to yield a great deal of information for you about what this person's perspective, approach, and type of work that they do is. The next thing I would do is reach out to whichever is your top 3 picks and request a 15-minute intake phone call. So that's a common thing, but it's not necessarily a standard thing. In other words, it might not happen if you don't ask for it. And during this phone call, you want to do a couple of things. The main one, in my opinion, is to figure out what modality this clinician is working within. So, for example, somebody might be very cognitive behavioral therapy oriented, which is behaviors oriented, versus someone who is psychodynamically oriented, and that's more of a classic kind of Freudian approach. These days, there are plenty of people who are integrationists, but even integrationists tend to lean in one direction or another. So one of your main purposes on this initial 10 to 15 minute intake phone call is to kind of interview the clinician and get a sense of how they work and see if that feels like a good fit for you. The other thing you want to do on that phone call is just also get a sense if you have a connection right away. Because no matter what their licensing or their credentials or their modality, no matter what any of that is, it's my belief that our gut will give us the most important information about whether this is the right person for us. And even on a phone call, you can make some assessments about your gut feeling on this person. And if everything seems to be in line, licensing, modality, and gut, then I would go ahead and schedule an initial meeting or intake or session with this person. That said, You might meet them in person and suddenly feel like, it's probably not a great fit. And if that does happen, I would strongly urge you to pay attention to those feelings, because the last thing you want to do is, just figure all clinicians are created equal. They are not. And the clinician that is the best clinician for my best friend might be the worst clinician for me. So you need to be very, very careful choosing this person and really base it on your instinct about them, because hopefully you're going to be doing really important long-term work with them that has a profound impact on your life. So like you choose someone to date and marry with very great care, I would advise you use the same level of care in choosing the professional therapist that you're going to work with. So finding the person, you want to first look for a few options that take your insurance and are within your area. And if they don't take insurance, or you don't have insurance, look for someone who offers pro bono sessions or can do sliding scales. It's pretty common. It's more difficult to find, but you can look, and most likely you'll come up with something. So do that first. Then research their credentials. After that, request a 10 to 15 minute phone call with this person and discuss what modality they work in. And also on that phone call, pay attention to your gut feeling about the connection that you sense with them. And if all of that is in line, then make an initial appointment for a first session. And once again, really focus in on your gut, and your heart and your mind and all of these things. And when you walk out of there, just sort of ask yourself, does that feel like a no, or does that feel like a yes? And if it feels like a no, I know it's extra work, and life is already complex and we're all busy. I get it. But if you walk out of there feeling like, I don't think so, please allow yourself, do yourself the favor, give yourself the gift of starting the process over again. And I want to add to that as well. If at any time throughout the therapeutic process, you get a sense that you made a bad choice for a clinician for yourself, you are always free to walk away, and you should, because plenty of times people won't be aligned well with a therapist, and they end up wasting a lot of time and money and not getting the sort of work done that they had hoped or that they could get done. So I know that it's a long, complicated process, and certainly starting over with a new clinician is not very appealing. I get it. It's hard. You're opening yourself up to a new person. You have to tell your whole story over again. It's not fun. But if your ultimate goal is true healing on many levels, then that's just sort of what needs to happen. So that is step 1. And tomorrow I will talk about step 2, which you'll find out about soon. Okay. Have a great day, everyone. Bye.